The broadcast is now starting. All attendees are in listen-only mode.
Hello. Good afternoon. This is Margaret Corto from the Office of Minority Health Resource Center, and I'm doing this presentation with my partner in crime, my coworker Henry Ocampo. We're both senior program analysts working with the Capacity Building Division at the Office of Minority Health Resource Center. And we would ask that if you have any questions, just write it down, and at the end of the webinar, we will try to answer the questions, or if we don't have time, you can send it via email, and we could answer it that way. Thank you all for joining us. We appreciate it. In this webinar, we will introduce our organization, HRSA, and one of its initiatives called HETAP, and some of the information which is relevant to today's webinar. We'll share information from 8 federal agencies, including funding opportunities, future funding directions, and what writers can do to strengthen their applications for federal funds. We'll provide information and tools you can employ in conducting a tailored research for federal funding opportunities, agencies, and topics which they focus upon. So, the Office of Minority Resource Center provides technical assistance and capacity building services to health agencies and organizations throughout the United States and its territories and jurisdictions. Higher Education Technical Assistance Program. The Higher Education Technical Assistance Program was designed to work with institutions of higher education, including minority-serving institutions. A training program of OMHRC, HETAP, helped our nation's colleges and universities, and is still helping them to become more competitive in securing resources and building partnerships by offering grant writing trainings. And these trainings are called UVDC, which is University Vision, Design, and Capacity. In 2015, HETAP sponsored 5 regional trainings around the country. We had representative agencies from the federal government. We asked each agency to provide us with agency mission, strategic plan, funding opportunities, and funding direction. A number of the research-oriented centers and initiatives with federal agencies were highlighted during the HETAP regional trainings. Here are some of the federal agencies that worked with us: the National Institute of Health, the National Libraries of Medicine, NIH's National Institute of Child Health and Human Development, the U.S. Department of Education, Institute of Education Sciences, and the National Science Foundation. At this oops.
We are experiencing technical difficulties. We seem to have lost Margaret's audio. Please give us a minute, please. Thank you.
Hello, everyone. This is Henry Ocampo, Senior Program Analyst with the Office of Minority Health Resource Center. Are you able to hear me okay?
I can hear you. And
Okay,
I'm
great.
getting responses from the audience, so the audience can hear you as well. But we still can't hear
One,
Margaret, and I'm not sure why. So Henry, if you would please continue the presentation. Thank you.
wonderful. Sorry about this, everyone. So let me continue with some of the slides for Margaret until we figure out what's happening with her connection. So we're on the slides with the HHS Federal Research Highlights with the National Institutes of Health, or NIH. So National Institutes of Health has 27 institutes and centers, and it's the nation's medical research agency making important discoveries that improve the health and save lives. So with our HETAP project, the Higher Education Technical Assistance Project, we sponsored three NIH institutes and centers in the regional trainings, and two are featured in this webinar. The first was the Eunice Kennedy Shriver National Institute of Child Health and Human Development, and NICHD, as well as the National Library of Medicine, NLM. Additional information on funding opportunities at NIH and its institutes and centers can be found at the Office of Extramural Research, or OER, and their website for NIH funding opportunities can be found on grants.nih.gov/grants/OER.htm. Next slide, please. Another HHS Federal Research Highlights is with NIH National Institutes of Child Health and Human Development, and NICHD. So the National Institutes of Child Health and Human Development mission focuses on women, children, and families. Some of the areas of research emphasis that this agency focuses on includes infant mortality, reproductive and gynecological health, pediatric and maternal HIV/AIDS prevention, as well as violence prevention. Some examples of their awards categories include their NICHD academic partnerships, community partnerships, that brings together academic institutions and community organizations to identify opportunities, health disparities, through the use of community-based participatory research. They also have research training and career development paths for institutional training grants to independent scientist awards. And when we ask them what are some of the key suggestions to prospective applicants for them to know, is to plan early and contact the project officers. Become familiar with this institute's strategic plan, register in the required systems, know the program priorities and funding mechanisms, follow the publications, participate in their hosted conferences and seminars, use the NIH report, an online portfolio research tool, which can be found on report.nih.gov. I think for a lot of these funding agencies, you'll see common theme of really getting to know each funding agency, as well as contact their project officers or program officers, and get to know them on an individual basis. You really want to start developing those relationships with your funders. Next slide, please. So next we have the NIH National Library of Medicine, and their mission maintains and makes available information, resources on a wide range of topics, supports and conducts research, development, and training in biomedical informatics and health information technology and coordinates a national network of libraries of medicine to increase access to health information in communities across the U.S. So some of their health disparity research emphasis includes living smartly with diabetes, using patient web portals and mobile phones for self-management, graphics to enhance health education materials for underrepresented populations, implementing Medline Plus Connect in Spanish to address health disparities. And some example of their award category includes information research grants to reduce health disparities, which funds projects that will bring useful and usable health information to disparity populations and the healthcare providers who care for those populations. They also provide training and career development paths, which is an example of their Mentored Career Development Award for junior investigators. When we asked them about what to tell, what to tell prospective applicants, they said to learn their grant process on their website, which is grants.nih.gov/grants/grants process. Prior to the submission of any application, also learn how your application will be reviewed and write with your audience and the reviewers in mind. They also have a link on that as well, NIH grant peer review process. So really get to look at that website and see how your grant application will be reviewed. Also think about becoming a reviewer as well, as this may make you a stronger applicant in the future. So with a lot of federal agencies, you can also become a reviewer. There is a website for NIH on that, on how to become a reviewer, which is grants.nih.gov/grants/peer/becoming peer reviewer. It is one of the best ways of learning the process of reviews, of grant reviews, and to kind of see what funders are looking for in these various proposals. So it will help you, we can get an inside view of how to make your grant proposals stronger as well. And a lot of these federal agencies have their own peer review applications, so so you need to kind of look at those websites, at their individual websites, and sign up as a peer review. Next slide, please. Other federal research highlights, we also have the National Science Foundation, or NSF, and their mission is to promote the progress of science, to advance the national health, prosperity, and welfare, and to secure the national defense. Some areas of emphasis for NSF research include support for all fields of fundamental science and engineering, building the science, technology, engineering, and math, or STEM workforce of tomorrow, and a STEM literate public by improving STEM learning. So some examples of their funding areas include the Centers of Research Excellence in Science and Technology, or CREST, promoting research and innovation and methodologies for evaluation, also known as PRIME, EPSCoR Research Infrastructure Improvement Program, building diverse communities, facilitating research at primarily undergraduate institutions, research in undergraduate institutions, and research opportunity awards. They also have some research training and career development paths. For example, increasing the participation and advancement of women in academic science and engineering careers, alliances for graduate education and the professorate, Lewis-Stokes alliances for minority participation, Dear College Letter, announcement of effort to broaden the participation of students in two-year Hispanic serving institutions in science, technology, engineering, and mathematics. When asked about, what are some of their key suggestions for prospective applicants, they recommended that to check out their the search engine and email notification system in NSF to allow end users to customize searches, notification when matches arise. For funding opportunities, go to their website on nsf.gov/funding. And for broader impacts, also check out the website on nsf.gov/pubs/GPG/broaderimpacts.pdf. Next slide, please. Another agency that we're going to be highlighting is the Department of Education Institute of Education Sciences, or IES. And so the mission of the Institute of Education Sciences is part of the U.S. Department of Education, and it's been a partner of ours since 2014. And IES supports research that contributes to school readiness and improved academic achievement for all students, particularly those whose education prospects are hindered by inadequate education services and conditions. Some examples for their research emphasis, you can look it up online. Their educational grants, research grants, special education research grants, and they're pretty much listed on their website. They also have the research training and career development paths, such training grant programs, for example, Pathways to Education Sciences Research Training Program. And some of the things that they would like to convey to prospective applicants is that to go check out their funding opportunities on their website, which is ies.ed.gov/funding. Also discuss your ideas with a program officer. Email a synopsis and schedule a time for a call with your program officer. Minority serving institutions are highly encouraged to apply for education research and special education research grants and training grants. And to receive emailed announcements about IES funding opportunities, sign up on their newsflash on the website ies.ed.gov/newsflash. So you'll be receiving regular emails for their funding opportunities as well. Next slide, please. And so here, on this next slide, we actually have a organizational chart of the U.S. Department of Health and Human Services. We just felt like we wanted just to put this up there to have a better understanding of what HHS looks like. So in the next few slides, we're going to be highlighting 4 non-research federal agencies within the federal government, which includes Office of Minority Health, Health Resources and Services Administration, also known as HRSA, the Substance Abuse and Mental Health Service Administration, or SAMHSA, as well as the Environmental Protection Agency, or EPA. All right, next slide, please. So this first agency within the Department of Health and Human Services is the Office of Minority Health, and OMH's mission is to improve the health of racial and ethnic minority populations through the development of health policies and programs that help eliminate health disparities. The Resource Center, OMH Resource Center, we're actually federal contractors with OMH, and we work hand in hand in moving a lot of their initiatives forward. So some examples of areas for OMH emphasis includes translating core minority health and health disparities programs into strategic activities and policies at the federal, state, tribal, territorial, and local levels. We also have specific efforts that are directed to minority populations which includes Blacks, African Americans, Hispanics, Latinos, American Indians, Alaska Natives, Asian Americans, Native Hawaiians, and Pacific Islanders. Some examples of OMH grant programs and cooperative agreements have included partnerships to increase coverage in communities initiatives, or PICC initiative, There's also the Minority Youth Violence Prevention, MYVP, integrating public health and community policing approaches, the American Indian and Alaska Native Health Disparities Program, as well as curbing HIV/AIDS transmission amongst high-risk minority youth and adolescents, also known as CHAT. So some suggestions for prospective applicants who are interested in OMH funding. Please visit our OMH's resources in areas of cultural health literacy and linguistic competency tools. We also have provide a capacity building technical assistance division, which Margaret and I are part of, for communities and academic-based organizations. We also have up-to-date data, national data on health disparity populations, which is on our website. You can also access our Knowledge Center, which has one of the largest repository of minority health information within the federal government, and you can access that online on minorityhealth.hhs.gov, as well as by giving us a call as well in our 1-800 number. Next slide, please. The next federal agency that we're going to be talking about is the Health Resources and Services Administration, or HRSA, which is primarily provides safety net programs in health for the nation. And so the mission of HRSA is to improve the health and achieve health equity across access to quality services, and also provide skilled health workforce and innovative programs. So some examples of areas that HRSA program has focuses on maternal health, community health centers, HIV/AIDS, organ donation, workforce development, as well as rural health. Some examples of HRSA's projects includes the Ryan White HIV/AIDS program, the Maternal Child Health Secondary Data Analysis Studies, SDAS. They also have workforce development. HRSA also has workforce development programs as well. They strengthen the health workforce with the Native Hawaiian Scholarship Program, as well as a Nurse Corps Scholarship Program. When we asked them about suggestions for prospective applicants, they emphasized that you need to pay attention to addressing the needs section in your proposal. Also, please keep in mind keeping attention to incomplete data, and visit their HRSA grants webpage on hrsa.gov/grants, and also register with grants.gov. Watch out for missing or incorrect DUNS on your application. And DUNS stands for the Data Universal Numbering System, which is a unique 9-digit identifier for each business. And lastly, also renew your SAMS registration. SAM stands for the System for Award Management, and this is a way to register your agency to do business with the federal government. Next slide, please. The next federal agency that we're going to be talking about is the Substance Abuse and Mental Health Services Administration, also known as SAMHSA.
I'm in.
Oh, wonderful. Oh, welcome back, Margaret. Thank you.
Thank you. I'm sorry, Henry.
No problem. Let me just continue with this. So with SAMHSA, their mission is SAMHSA's mission is to lead public health efforts to advance the behavioral health of the nation and reduce the impact of substance abuse and mental illness on America's communities. So some of their program areas they focus on includes strategic initiatives to help provide treatment and services for people with mental and substance use disorders, support the families of people with mental and substance use disorders, build strong and supportive communities, prevent costly behavioral health problems, and to promote better health for all Americans. So some of their grant programs include the statewide consumer network program or consumer network grants, primary and behavioral health care integration, the minority serving institutions partnership with community-based organizations grants, as well as the Garrett Lee Smith Campus Suicide Prevention Program. So some of the things that what SAMHSA wanted to highlight for prospective applicants is that their funding announcements are posted online on samhsa.gov/grants, as well as on the grants.gov website. You can also sign up for their email updates on their website and complete the registration requirements as soon as you know that you want to apply for one of their grants. Also contact their program officers or agency contacts for any funding opportunities, and these contacts are listed on their RFAs or requests for applications. Next slide, please. The last agency that we're going to be highlighting, which is actually not part of HHS, but still a federal agency, is the Environmental Protection Agency, or EPA. And the EPA's mission is to protect the human health and the environment. So EPA's purpose is to ensure that all Americans are protected from significant risks to and the environment where they live, learn, and work. So some of the areas that they emphasize includes climate change and improving air quality, protecting America's waters, cleaning up the communities and advancing sustainable development, safety of chemicals and preventing pollution, enforcing environmental laws. Some of their research, training, and career development path programs include research and training and fellowships, greater research fellowships for undergraduate environmental studies, and some of their projects that they are funding. Grant programs include the National Environmental Information Exchange Network Grant Program, the College Underserved Community Partnership Program, the Health Watershed Consortium Grants, Healthy Communities Grants, Environmental Collaborative Problem-Solving Cooperative Agreements. And a lot of these information can be seen on their websites, which is epa.gov/grants. Next slide, please. And so with this webinar, we just highlighted about 8 agencies that really have a wide breadth of activities and funding opportunities for communities to access. And we've been delighted that you're all here to hear some of these some of these potential funding agencies that you can potentially access. And as with each funding agency has its own unique requirements. It also has its own focus as well as its own expertise. But there are some general across-the-board reminders that they also wanted to convey to you as well. So when you're writing your grants, the development of effective strategies and methods in identifying funding opportunities, it takes time. It also requires practice, and it needs a lot of patience. So with number 1, it's also ensure that your organization or institution's research programmatic interests are in alignment with the federal program's interests. So, as you mentioned in the previous slides, each funding agency has its own interests and areas that they're looking to get for funding. So make sure that your agency's interests are in alignment with the funding interests as well. Number 2, don't take a non-funded application as a failure. Funding environment is very competitive, and there are many outstanding proposals not funded due to level of funding availability. Remember that for most of these applications, funding applications, it's a competitive process, and not all good or even great proposals will get funded. So this is one of the things. It just means that there's been so many. It could potentially mean that there's so many applicants but only a few amount of money that's able to go out as funds. Number 3, remember the 3 R's: review, revise, and resubmit. Always with attention to the comments of reviewers and making sure to address these in your resubmission. Number 4, there's also the HHS regional offices can be of assistance to potential applicants and information, and these can be found on the website hhs.gov/IEA/regional. So for a lot of the federal agencies, not only contact the program officers who are in charge of those specific grants, but also you can contact your regional representative for that federal agency, which can be even closer to your home, and you can ask them questions as well and use them as a resource for any of these funding opportunities.
Henry, I wanted to add something to the first bullet, number 1, that says ensure your organization, institution's research programmatic interests are in alignment with the federal program's interests. I think one of the things that we hear a lot about is the immigrant populations that don't have data to support whatever program they're trying to run. And what I've been telling people on the phone is that it's important that you're able to look at the community that you're trying to work with and also look at a community that mirrors them. For instance, if you're talking about the African immigrant refugee group or any of the refugee groups coming into the country that don't have a specific designation for their population, you could look at the population in a whole, and then if you can identify what the cultural issues are in that particular population, why you think that funding, you're trying to get this money to address the issues that they're having, you might run into somebody who would take a second look at that and fund it. So it's not always that you should match the federal interests all the way. But if they're looking for cancer and you're trying to do cancer in Vietnamese population, then you need to look at the overall population and then carve out why you think the Vietnamese need special care. Not that when they're looking their RFPs for cancer, then you want to talk about diabetes. So I just wanted to make that a little clearer.
Wonderful point, Margaret. Thank you so much. And also, that's one that also brings to mind one of the things that I also, when I tell prospective grant writers, when they're writing their proposals, is to think put in your mind why is this issue important in your community, and why does it need to be addressed now as well. Okay. We are on the next slide, please. So some additional suggestions that was brought to us from these federal agencies, from these funding agencies during our HETAP sessions includes that some federal agencies hold annual, biannual, and sometimes regional conferences, and these provide an opportunity to interact with federal program staff, learning about the emerging trends that they are tracking, as well as future funding priority areas. As I mentioned before, it's all about relationship building. Really get to know the program officers, the regional program federal funding agency representatives, and so really start developing the one-on-one relationships with these folks, because you'll get a better idea of, what's coming down the pipe, what's available, how possibly how to make your application stronger as well. Also, don't forget the value of collaborations. Future successful federal funding may start from partnerships or on the ground that established with other local organizations, colleagues, etc.
Yeah, and I want to talk a little bit about that too, because that also includes community-based organizations that are targeting the population that you want to work with. And most of the time what happens is people write a grant and then they go to look for people to pay to take the programs to the community. But if you're able to partner with a community-based organization that is already doing the work with the population that you're trying to get to and write them in the grant, then it shows that you're really reaching out to a population. And even though you might not have the expertise or the cultural nuances of that population, you brought somebody in who already works with the population, so that when you do get the money, it'll be seamless. Working with that population will be seamless. If you haven't worked with that population and you're not part of that population, but you're looking for money to do that work, it goes to beg the question, how are you going to get into the population? And I think a lot of people, the reviewers who look at that, and we all know now that there are a lot of populations in the U.S. now. So if you want to write a federal grant to do the work, then try and target community-based organizations that work with that population, or even universities where there's a large group of that population. There are students where they already have some working with the population, so they can bring it into the grant writing.
Great. The next point is follow what data and the resources are featured on federal sites in order to properly report new research and program areas of federal interest and funding. The last point is follow what is published in major publications, papers, and articles, and who is acknowledged in the subject area and field of your interests. And this goes back to validating your points about why your priority area has been selected, and make sure that you have, that you have data or current data on the population that you are looking to support in your activities. Next slide, please. And so funding opportunity announcements, or FOAs. And so this is basically the availability of federal funds that is made publicly known through the issuance of a FOA, or funding opportunity announcement. And through this announcement, a federal agency makes known its intentions to award discretionary grants or cooperative agreements, usually as a result of competition for funds. And the federal funding opportunity announcements may be known as can also be known as program announcements, or requests for applications, notices of funding availability, solicitations, or other names depending on the agency and type of program. And their funding opportunity announcements can be found at specific agency websites, as well as through sponsored websites such as the grants.gov. And so we've talked about some of the, that each agency do post up their funding availability on their websites as well. And you can check out and go to their websites directly on that.
Yeah, they can also call our 800 number, 1-800-444-6472, and we have capacity building. We have information specialists here who would send you a form to fill, and once you fill that form and they get to know what you do and what you're looking for, we'll be able to look for grants for you also.
Oh, great point, Margaret. Thank you. So just to reiterate that, so one of the free services that that we have at the Resource Center, at the OMH Resource Center, is that we can do focused grant searches for you. So we do have a one-page, just application form, which is just basically your agency contact and the areas of focus that you want, activities that you're interested in looking for funding for. And then we have information specialist staff who will actually do the legwork for you and look to see what funding available is out there for that specific area of interest. That's not only with the federal government, but also including foundations as well. And we usually have a turnaround time about 2 weeks to get that information to you, and it's a free service from our agency. Next slide, please. So we talked about, just want to go over some quick definitions of 4 types of funding mechanisms. The first one is grants. So grants is when the sponsor does not expect substantial programmatic involvement with the recipient or grantee during the performance period. With cooperative agreements, this is when there's the expectation that there will be a substantial programmatic involvement or coordination with the funding agency. Contracts are when the principal purpose is a prescribed service or good that is of direct benefit or use of the sponsor. So you can find opportunities at www.fbo.gov, and FBO is a federal business opportunities. The last term that we'll kind of want to just quickly go over is the sub-award or subcontracts. And so this is when a substantive portion of your research or program effort or a prime award is actually transferred to another institution or organization to do those activities. So this one, one agency is the primary grantee, and then the primary grantee will contract out for additional to another agency to implement some of these programmatic activities. Next slide, please. Eligibility requirements for federal grants and cooperative agreements. So with each type of federal grant program has its own set of eligibility requirements, and these eligibility information is pretty much in the FOA section that describes the applicant institutions targeted for the grants announcements. And these eligibility may include, like, if it's individual can apply for them, or organizational eligibility. It can also be geographic as well. It can include tribal, territorial, institutional, or government eligibility. Sometimes also whether you're a domestic or a foreign agency that can access these grants or these funds. So look at the eligibility requirements for in these FOAs, and they'll pretty much describe who's eligible to apply. If it's not clear, you can also contact the program officer that's listed in the FOA as well directly, because there's been some, I know there has been some times when the eligibility was not clear on who can apply, especially for folks in the U.S. territories that wasn't explicit enough in their funding announcements. But it's also a good time just to contact the project officer around that. Next slide, please. So to find the information, you also can go to sponsored federal sites. So there are a variety of sponsored sites, meaning sites supported in this case by the federal government. And each site provides a different type of level of information on funding availability important to prospective applicants. And many of them can be used in tandem to help prospective applicants plan strategically and chart where the funding is in the short and long term. Other sponsored sites provide prospective applicants with funding history, including geographic funding patterns and types of agencies and specific awards that were made. Next slide. I think, Margaret, this will be you.
Okay. Sponsor federal sites. Okay. So we are talking about sponsored federal sites at grants.gov. And this is a governmental central storehouse for information where prospective applicants can locate and apply for federal grants on funded programs. And once you go onto the grants.gov, you'll find funding opportunities for all 26 agencies that award grants. So you look among the 26 and see who would probably be having the type of grant that you would need. And they have open grant opportunities, can be searched by newest opportunity, funding categories, agency, and eligibility. And there's a way to sign up for the email notifications to receive information on new FOAs. When potential applicants have identified an opportunity, they must register with grants.gov in order to validate their organization. Next slide, please. There's a database of planned grant opportunities proposed by its agencies, HHS Grant Forecast, and each forecast record contains actual or estimated dates and funding levels for grants that the agency intends to award. So these are grant forecasts. This is what they're going to be doing in the future. So you can go there and look at what they're forecasting. And the forecast opportunities are subject to change based on enactment of congressional appropriations. And you can see all the grant forecasts by going to the link below. Next page, please. These are the sponsored federal sites, tracking accountability in government grant system. This is a database which is a central repository for grants awarded by the 11 HHS operating divisions. It tracks obligated grant funds at the transaction level. It can provide potential and current grant recipients information on what types of funding specific agencies have issued, to whom, amount of grant, and where geographically. This helps you see whether or not they have awarded grants to whatever geographic area you live in, or the type of work that you're doing, who got a grant, how much they got. So this kind of helps you prepare for applying for different types of grants. Next slide, please.
One more, just want to add in. So we have these two websites. So the one previous to that is the HHS Grant Forecast. And so that shows you where federal agencies are thinking of in funding in the future. And then when you go look at tags or tracking accountability in government grant system, that website actually lists out through 11 of the HHS operating divisions who they actually funded previously. So you have a website that looks at what's going to be coming out, as well as another website that's looking at what has been funded, and you can kind of gauge to see where would you fit in your programs in accessing any of these funding opportunities within the federal government.
Okay. Next slide, please. Thank you, Henry.
Sure.
So where do we go from here? This webinar presented many resources of federal funding, provided some specific examples, and highlighted many useful tools to use in your search for funding opportunities. And OMHRC is working on its HETAP page. I think it's up now, and it has some HETAP PowerPoints. And so you can go on the OMH website and look at the PowerPoints. Another OMHRC resource is the FYI, which is a weekly health newsletter. It's published every Wednesday. It includes a funding guide section that promotes federal and non-federal grant opportunities, as well as scholarships and fellowships, mentoring, and low repayment opportunities for students and young professionals in health-related fields. And to subscribe to this, you can send an email to info@minorityhealth.hhs.gov, or you can call us at 1-800-444-6472. Next slide, please. In closing, we'd like to thank you for participating in today's presentation of getting to know the federal government and funding opportunities. And for more information about copies of this presentation, you can go to our website, or you can call us at 1-800-444-6472. I think we have a little time for Q&A. Maria, do you have any questions?
We did receive one, but it's been answered. Someone wanted to know if there's a way to get notifications of funding announcements as they come out, but you've already mentioned how they might be able to do this.
Yeah, so let me just quickly just answer that again for folks. So there's different ways of getting funding announcements. That's, especially that's going to be sent directly to your email. The first and main one is to register your organization at grants.gov website. So all 26 federal funding agencies utilize this portal to send out their funding announcements. So definitely, get into the grants.gov. If you want to focus on specific federal agencies, just go to their websites and then sign up for their, get on their e-list serve, and they'll send you directly when they come out. Also, then the third thing as well is we at the Office of Minority Health Resource Center, we have a weekly e-listserv that we send out every Wednesday that Margaret just talked about, where we collect everything that's been announced that week regarding minority health information, such as funding opportunities, toolkits, research, different events, and we put that all in a very easy email blast that's released every Wednesday as well. And then the fourth thing is, just to reiterate, that we do, as a free service for folks, we do targeted funding searches for you, looking within the federal government as well as foundation grants. And this is a free service with a turnaround time of about 2 weeks or so, and you can utilize that as well.
Okay. Well, I want to say thank you again for participating in today's presentation. If you have any questions after this, you can always send us an email, and we will try and find the answer for you.
Actually, Margaret, do we have time for a quick question that just came in?
Sure.
Someone is asking what the registration process is to become a grant reviewer.
Henry, you want to answer that?
I think it's for each one. It's a user basis. Each agency has its own review process, grant review process. So you just have to go to their individual websites and sign up. So it varies. I can't really tell you specifically, unfortunately. Just go to, if you're interested in a particular federal agency or emphasis, and just go to their website and sign up. But there's always ample opportunities, because they're always looking for reviewers for the grant proposals.
Yeah, sometimes they send requests out looking for grant reviewers, so you just have to fill it, and if your resume matches what they're looking for, that's the other thing, because just because you fill the application that you want to be a grant reviewer, does not mean they're going to call you, but they're looking for reviewers. So if your application looks like something that is useful to them, they will call you. Any more questions, Maria?
We have one here that says, how do we set up a targeted FOA?
I'm looking to see if I can get this question. How do you get to get information on specific like focus groups, focus areas for funding? I think when you sign up for in grants.gov, you can actually pick what focus areas you're interested in as an agency, and you would receive those funding opportunities for those specific areas. That'll be sent to you by email.
And I also think when you fill out the form for HRSA to do the grant search for you, if you put in what your target area is, they also do very good targeted searches for you. Any other questions, Ms. Maria?
No, no further questions at this time.
Okay.
Great. Well, thank you everyone for participating in today's presentation. And if you do have further questions, please contact us at 1-800-444-6472. Otherwise, you'll also be receiving a, Maria, correct me if I'm wrong, but they'll also be receiving an email with the recording of this session.
That is correct. The email will go out either in about 6 hours or 24 hours, depending on how quickly we can set up the recording. You can also send us an email at info@minorityhealth.hhs.gov. If you had any problem accessing the slides, there is a PDF copy of the slides in your handouts tab, but since we're about to close this out in a few minutes, if you don't get a chance to get them today from there, we can certainly email you the slide sets.
Great. Thank you, Maria. So thank you, everyone, for sticking with us through this hour, and I hope you have a wonderful rest of the day. Thank you.
Yes, thank you, everyone. Thank you, Maria.
You're welcome. Thank you very much, and thank you for joining us, everybody.